I'm Jim Czek.
I'm Renee Merrifield.
That's you
Ian,
now,
this is
Ian.
Ian Burns.
And we got a special guest today, Iain Burns on Beyond the Ballot. Again, lots to talk about, but we're going to start in Kelowna because the first I heard of this story was actually Renee brought it up when we were doing Beyond the Ballot show, and then all of a sudden, this thing has broken into a major story here in Kelowna. We're trying to get more answers. You know, KGH in crisis, and it started with the pediatric center, and then my phone goes off. But yeah, so lots going on, and then Interior Health finally sent us like a statement because they obviously don't do interviews. They don't have enough people in the communications department. So,
Yeah,
what do you?
this is not a new thing. This is not a short-term issue. This is not something that has just happened. Back when I was still in MLA, I held several meetings with many of the staff at KGH, and this was a huge issue already back then. The pediatricians were being asked to do things that they had deemed unsafe, that their college had agreed with them on as being unsafe, and in large part trying to cover too much of the areas without the correct training. So, as you know, pediatricians who work with those NICU babies, those 1 and 2 pound babies, are very different in terms of their skill set than those that are dealing with a 4-year-old with a chronic infection or with a type 1 diabetic diagnosis, etc. So pediatricians are very sophisticatedly trained, and our pediatricians at KGH were being asked to basically do it all, to which they were saying that's just not possible and it's dangerous. We're going to make mistakes. There are things that are going to not be handled in a correct manner. Now we've got the obgyns who are obstetricians and gynecologists who are saying our maternity care is so poor that we're literally delivering babies because women don't have a GP, and at the same time we're being asked to deal with really traumatic and very difficult acute situations. Their college again is coming out in support of these specialists and saying this is not the way that medicine is conducted, and this is actually putting the patients' lives at risk. If you asked for a better, indicator of how things are going at KGH, there wouldn't be one. We are literally in crisis mode, whether it's the ER, whether it's our surgical suites, whether it's the obgyns, whether it's our cancer centers. We are simply so understaffed and so spread thin. And finally, we are seeing the cracks widen enough that the public is being let in.
Yeah, there was the discrepancy in what Interior Health is saying and what the doctors are saying in their letters as well. Maybe Iain can go into that a little bit. Unless Iain.
Yeah, well, I think Renee sort of outlined it there. Can you still hear me?
Yeah.
I'm still there. I think Renee sort of covered it there, as I understand it anyway, which is it's more about organisation. It's more about the duties that they've been given. Whereas Interior Health seems to think that it can just be solved with numbers, like more staff. But the doctors don't really seem to be saying that, and nor does there's a doctor that posted on Instagram a video where she explained that it's not to do with like low staff levels. It's because we're being spread too thin and we're being asked to do things that we shouldn't do, which is quite an interesting take, really, because usually in these situations, anything to do with health, usually the answer that we hear is more staff, like that will fix it. But in this case, it doesn't seem to be that. And in a way, that's a cause for optimism, isn't it? Because we know how hard it is to get new staff. So if that's not the problem, it should theoretically be quite easy to fix. But it's been going on for quite a while, so I guess it isn't easy to fix.
And I think in large part, what they're being asked to do is cover off, jurisdictions that are not within their typical scope, that are not what they were trained to do, that are not, able to be accommodated in a way that doesn't sacrifice another patient. And so you can't recruit to that scope that isn't actually part of what let's call it a NICU pediatrician should be doing. A neonatal intensive care unit specialist is going to be very differently skilled and very differently trained than would a pediatrician who's dealing with cancer patients or pediatricians who are dealing with orthopedic issues. So they're saying this is not correct. And not only is it not correct, but I don't have the jurisdiction to deal with that. It's like going to an ER doc, or that's a poor example. It's like going to a cancer doctor and asking, whether or not they can treat you for diabetes. You just simply wouldn't do that. That is, they're not trained to do that. They're not trained to monitor those types of issues, and they don't even have the skill set to be able to diagnose or to prescribe the correct medication or a treatment protocol. So this is a huge issue, and it really, really is it's showing the cracks that we have right now within our healthcare system.
Yeah, the level of frustration with doctors and nurses must be very high, because they're usually very reluctant to speak out, but a bunch of them have come forward. And then the initial amount that came forward signed that letter, and then they thought that would be it, but then a whole bunch more came forward and supported that. So that's where they had some strength in numbers. And the NDP government's been kind of hiding too, with all these crises in smaller rural communities where it didn't get as much attention: Lillooet, 100 Mile House, Oliver, and all that. But all of a sudden you have Kelowna, which is like outside the Lower Mainland, one of the biggest regional centers, and all of a sudden that's in crisis. They really need to look at this.
Yeah, and Jim, it's not just one of the largest. It is the largest regional center. It is the tertiary hospital for the entire interior. That is a massive responsibility, and it is to have the ability to care for all levels of patients and be the referring hospital inside. I've heard stories of children's and women's hospitals, so BC Children's, BC Women's, literally saying, "Why are you referring us patients?" And Kelowna saying, "We just don't have the capacity right now," and being denied, because Kelowna should have the capacity. I had a family member who was ill last week, and I was hearing on the hospitals and in the wards, all of the chatter from the nursing staff that were talking about, well, we can't admit that patient, regardless of whether or not they're 30 months old. We're going to have to send them on to Vancouver or Kamloops or, another hospital. That is ridiculous.
Yeah.
And we should not be in that situation at all. The ER sees upwards of 30 pediatric patients every day. Women are being denied care if they are pregnant. We simply do not have anyone receiving a patient that is pregnant right now in Kelowna. So it's we are hitting mission critical, and it's time that some really dramatic actions are taken.
Do you think perhaps that the NDP have really rely on political motivation all the time? Because they're advertising in the United States right now to get doctors and nurses, and thinking that people are going to come here for half the wages and double the taxation, and that because they're all trying to escape Trump. Do they just oversimplify it into a political statement, as opposed to how do we fix it so that we can actually attract doctors, not just because that's worse and we could get some doctors from there?
I would say that the NDP are very poor at executing on some great virtue. So do I believe that for 1 minute the NDP want to have patients suffer? No, I don't. I don't think they want to do a poor job, but I don't think that they are attacking the problem with the correct thought or the correct lens. Adrian Dix knew about this issue back in September. He knew about this issue back the year previous, when the pediatricians quit en masse here at KGH. This has been brewing under the surface for a long time. The only difference right now is that we actually have the physicians going public because they've had enough. So we're talking about years of simmer and boil that is finally coming to the surface right now. The NDP have had ample opportunity to fix this. They have not. They have basically turned a blind eye and said that the problem doesn't exist and that it'll fix itself. It's not fixing itself. It's not fixing itself in all of the ERs that are closing on a rolling basis. And, I was recently talking to one of my former board members that was a board member with me on Interior Health Authority back when we were board members. And I said, could you imagine us under the former BC Liberal government ever being allowed to close one ER, never mind closing ERs on a repeated basis over the course of time? And he and I had a chuckle over it. This is serious, and the level of accountability within our healthcare system that we have allowed government to exist at is really dangerous. And I hope that the public kind of wakes up and starts really activating on this front.
Iain noticed that it was about a year ago that the NDP was advertising in the United Kingdom for doctors. And so we reached out to see what they got for that. And they said they don't have the number. And we've done a Freedom of Information ask about a month ago, and we still don't have that number. I don't know if you can add any color to that, Iain.
Yeah, well, it was a strange one, I think, that one. But probably more chance of getting them from England than getting them from the US, I would say, because they do actually, I think they would get paid more in British Columbia. But just the very fact that they didn't respond to our inquiries, that gives you the answer already, doesn't it, really? It wasn't a success. Because if it was a success, they would have held a press conference like they did last week or whenever it was to brag about a certain number of inquiries to a website from Americans and get some American nurse on Zoom to talk about how great British Columbia is. They would have done that if it was a success. So I think we can safely say that it was a failure. The question is just to what extent was it a failure, really, I would say. And then just one other comment I wanted to make there about what Renee said about, if this had happened under the BC Liberals or BC United or whatever, that, there would have been hell on. But the question I have, is that not the fault of the opposition to some extent, that they've failed to really put pressure on the NDP over this? Because I think I consider this to be egregious. I mean, this is astonishing in a first world country, in a place like Lillooet, to repeatedly be told, unfortunately, you've lost your leg here, but you're going to have to drive across a mountain 2 hours to Kamloops, and they maybe will have capacity to see you there. I mean, to me, I feel like if I was advising Rustad or whoever, I'd say, like, just never stop speaking about this. You walk around with a sign that mentions this constantly, but they don't really seem to hammer it that much.
Yeah, I would say that I know that it was a big issue that we held in question period and during estimates. It was something that we hammered on a consistent basis. We got, we also did and it's hard because it takes a lot of effort and a lot of work and a lot of, beating the same drum before the media take attention. But, we were the ones that were talking about the safety and the different protocols that were being used inside the hospitals for drug addicts, and, that they were allowed their knives or their weapons, etc., and their drugs inside of the hospital, and that they were using inside the hospital, that the drug dealers were coming into the hospital and that they weren't allowed to be denied. So we sounded the alarm bell. We saw some change, but I would say that opposition is only as great as what the media picks up and starts to put towards the public.
I was going to say that.
We have a very pro NDP. So for Vaughn Palmer to finally pick up the sword and say, wow, Kelowna has no pediatric ward, I think is quite remarkable. And I heard Gavin Dew. I've seen him on CBC. I've seen him, really trying to sound the alarm bell on that one. I do think that, that opposition should stay on this topic 100%. And I'm hoping, because we had like the Surrey emergency docs say, we're not giving a quality of care. We're seeing people die, as they're waiting. And we had some big stories that we blew. But, the public seems to lose interest in it over time, or starts to accept it as the new normal. And, I wish that people could go to a different healthcare system and just for a moment see how great healthcare could actually be. Canada ranks dead last in socialized healthcare, in all of the OECD. And I think that we need a different way forward, and one that we can learn from other jurisdictions and from other countries that are doing it far better than what we are.
I think that the media is a big component of this because, one, the NDP won't respond. I mean, you can tell us how many times we reach out and don't get a response from Adrian Dix, Bonnie Henry, all the likes of them. How many times we respond and get zero response? And during COVID, we weren't even allowed to ask questions. And then the media itself is kind of biased and definitely not helpful in that regard. But when they get to select the media they want to talk to, and then they selectively don't even respond to us, that is the fault of government. And that's where the opposition should pick that up as well, because Iain, you could speak to what goes on in England, and you just had a response to the U.S. State Department and maybe just relate that experience.
Yeah, I would say I think that's almost a cultural problem, isn't it? It's almost like a civilizational problem, because there's no real formal system in place for dealing with the media. It's all pretty sort of ad hoc in in our democracies in the West. It's not like you have a right to have your question answered or something like that. It's more a culture of transparency, and it's the responsibility is entirely on the person with power to sort of submit and say, okay, let's have an interview, let's talk. And if they say no, there's not all that much you can do about it other than raise a fuss and then hope that they get scared enough, the person in power is afraid of what you've done, and they say, okay, let's do an interview, to try and like salvage their reputation. But I mean, it's funny that you should say this, because I just got an email back from Brenda Bailey's media person, saying that unfortunately, not only is she not available for an interview as she said she was going to be, because she's going to be in Kelowna in a couple of days, but she's also not available, I assume, ever for a video interview, because that's also not going to happen. But we have been given permission to chase her around and see if we can put a microphone under her chin, see if she'll say anything. So that's something, I suppose. But as for the U.S. Department of State,
the finance minister of BC will not do a video interview.
Not with us, no. And it's funny because she obviously has been in government for a while, and in her previous job, Minister of Jobs, she did do a video interview with us, and it was actually quite a chummy, pleasant interview. I thought that Jim did a good job, and I think she quite liked it. But yeah. I suppose now that they've just won an election, just about, they have no need to speak to plebs such as us. But no, the funniest one of all is the Prime Minister's office. They are the absolute worst. So they have the most important job, I would say, in political media management, the most power, and they're probably the worst, I would say, in the whole sort of provincial and national landscape. They routinely just don't respond. So I asked them quite recently, a couple of weeks ago, when Netanyahu by name attacked Mark Carney, an absolutely astonishing thing to happen. A leader of a democracy, of a major country and a major ally of Canada, by name insulted Mark Carney to an extraordinary extent, basically impugned his humanity and his morality. Really shocking thing to have happened, completely ignored by the Canadian media. Jim and I chatted about it for a bit, and I thought, okay, well, it's going to have to be me then. I'll see. Sent an email to the PMO, just completely ignored. Still not had a response from them. And on the same day or same week, I sent an email to the US State Department, which administers the American empire. They've got quite a lot on their hands, obviously. And within about sort of 15 minutes, they were back saying, yeah, I'll look into this for you, mate. I'll fix this for you. I'll sort it out. It's just kind of, there is, I think in Canada, you mentioned England, Jim, the culture in Canada, from what I'm familiar with, is by far the worst. Like, it's really, really bad. For a media, media officer, or whatever they call themselves, press officer, for them to feel like they can just ignore an email from a journalist, the culture is already rotten. It's already toxic at that point. Because I worked for the British government in press for a little bit. Absolutely no chance could you ever ignore an email. Just never. You would be fired. You would be put through a sort of disciplinary process for doing that. It's just not permitted. And that's obviously what the US State Department has. They have the same policy. Why do we not have that in Canada? I wonder. It sort of says something about the media landscape in Canada that they feel like they can just ignore it. And when I was working in England, it would be anybody. Anybody sent an email. I remember getting emails from obscure publications in India asking me questions about like really niche, weird things like ritual slaughter and things like that. And obviously, yeah, okay, I'll work on this. I'll sort this for you. But in Canada, it seems you ask a basic question like the Prime Minister of another country just said that the Canadian Prime Minister is immoral and basically accused him of being evil. Do you have a comment? No response. That's remarkable.
And the selectively, like even Brenda Bailey I interviewed before, obviously they're selecting because they at first said they'd look into it. And then they've decided that they don't want to do it because obviously they think, like either A, I don't know what that we're not friendly enough, or B, I'm not sure what B or C or D is, but they just don't feel they need to respond. And we've had that same problem with Adrian Dix. We've had that same thing with Bonnie Henry. And this has been going on forever. Even Interior Health here in Kelowna, they have like 14, 15 people in communications. You can't get a comment from them. So what is it that they're communicating? Why are we paying those salaries for communications departments that don't communicate?
Yeah, they don't communicate with the outside. And I think that has, I think that actually signals a bigger problem. Are the public actually demanding that transparency? Is the media hunting down, the answers that we're trying to get, and sounding the alarm bell when they don't actually get responses? Like, I think that, you guys even coming here today and talking about this is really profound. And I think that we as citizens need to take note and say, you know what, our elected officials have decided that they get to choose who they talk to or who they don't. And they get to choose which questions they answer and which questions they don't. I mean, that is for the public to kind of, take note of, and then also take exception to, and say, no, you don't. You do have to answer my question. And in this particular case, I think that patients and in patient care, really needs to sound the alarm bell. I think that, finally we have doctors and physicians who are speaking out, but we can't leave it there. We need to keep, pressing in and figuring out, how do we hold our elected officials more accountable to the outcomes that are delivered? Not like, Adrian Dix used to drive me crazy with his statistics. And, I just started memorizing more statistics than he had. It's like, yeah, you want to talk numbers? Yeah, let's go head to head. Those 4 new MRI machines, well, you've actually delivered, try and not one up him, but almost deflate what those statistics mean. We're spending 3 times the value of a nursing staff member right now on travel nurses. That was a big story for a little bit, and now all of a sudden it's gone. We need to keep the pressure on our government officials and keep demanding, better outcomes, because they are possible. It is not that we need to accept the status quo. Dr. Brian Day just wrote a book, and I'm only a chapter into it, but really interested to see, what his, after going through a 30-year battle with government, and really all different kinds of government, what he believes the prescription for Canadian healthcare needs to look like. So I think that we need to sound the alarm bell. I did see a couple of individuals, I believe it's Shelley Sawchuk, that was waiting 4 days in the comment section here to be flown to Vancouver for a broken neck, and was stuck in the hall. And the gentleman that was also there, who was, struggling with substance use, got food and blankets, and she had to have her child bring her food. I wish that was not a true story. In sitting in the emergency room this last week for a number of hours, I watched that same phenomenon happen, where, eventually I brought my family member. It wasn't actually me; it was my brother-in-law that organized food for my family member, who was asking for food all day, had been waiting, throughout the day and throughout the evening and throughout the night for food. And as a type 1 diabetic, that was a very difficult situation for my family member. And yet there was a whole fridge of sandwiches that we kept watching, because it was hallway medicine, which don't even get me started on hallway medicine. I cannot believe that we actually have now alcoves named, because that's where the beds are, is in the hallways, and they are named with an actual name there. But watching the fridge open and close for many of the street entrenched individuals that knew that there were sandwiches in the fridge.
So they get to hide all this, and I'm going to go back to the media. They get to hide all this because, one, they say to us, like media outlets like us, you can't have an interview. You can possibly do a streeter, and then if you do a streeter, I've seen it happen. If you try to get them on the street, they say, "Oh no, book an interview with my office. I'm not taking a streeter." Or CBC will then say, "Oh, look at those reporters chasing people down the street. Those aren't real journalists." And so you're just caught in this vicious loop. Like they won't answer questions. Like if you look at Stephen Guilbeault, when he basically runs from the press. And say what you want about the United States. Like they do more right now, they do more in front of the camera than I've ever seen. Like they'll take interviews all the time. And how do you have accountability? If you look at Parliament, They don't even want to sit parliament. You and I have talked about this, Renee. Like, look at the parliamentary calendar. So that's question period. So you only get, there's very little question period. And then you won't be held accountable by the press. You won't even respond to Iain. Iain worked for the Daily Mail. He's got credentials coming out of his wazoo, but he doesn't have CBC beside his name. And we're not state-funded media. So they don't even respond. Yet Kelowna now can send an email to the State Department and get a response within an hour.
And you know what? Isn't that a story? Like, couldn't you actually do a, here's what we've tried. Here are the FOIs that we've done. Here's the, here's the streeter that we were told to call the office. So we called the office, and this is what we were told. You could literally do the whole story on the erosion of accountability.
Do you know what? Somebody who does that all the time, Holly Dona Blacklocks, that's what she does. She does FOIs all day long. That's how they build their business. You know what she gets called? Yellow journalism.
Yeah, well, there is a bit of a sort of rule, an informal rule, and you learn that it's real when you break it, which is that you don't pull back the curtain and show everybody how it works. So you don't talk about press officers. You don't name them. God forbid you should ever name a press officer. That's like a declaration of war. And then, it's a gamble. So if you write that story and you go all in, you attack the press team and you say they're dodging questions, they're dodging the media. It's a gamble because that story might fall flat. People might not be bothered about it. Like you said, Renee, people forget about massive crises. They'll be interested for a week, and then the public sort of forgets and they move on. So if you gamble and you do that, you burn your bridges, and then they'll sit and be patient. They're there forever, and they'll just stop responding to your emails. Even if they ever responded, they'll just not respond ever again. You'll not be allowed into events. If you call up, because obviously with the province, they live stream most of their press conferences. I've called many times. I've succeeded one time in asking a question of Adrian Dix, which he didn't seem to like very much. But on other occasions, I've been in the queue, and I think they've just seen my name, and I just hear like a dead tone. They just hang up. They can do things like that. And ultimately, all I can do, or we can do, is write those articles. And, if it doesn't achieve anything, then it's kind of, you lose ultimately, and they win. I mean, I don't know if you remember when Justin Trudeau came to West Kelowna, and they went to extraordinary lengths. That was my first real, unpleasant encounter with the PMO, where I realized that they were actually that petty and that partisan and that childish, that they would ignore my calls, ignore my emails, not tell me where Justin Trudeau was going to be, even though it was in our patch, just because they didn't like us, I assume. And then afterwards had that conversation with them where they tried to say that, we just didn't see your emails in the inbox. That is such an obvious lie. As somebody, again, who's worked in government media, every single email that comes into your inbox. That's such an obvious lie, transparent nonsense. And then I was called and apologized to sort of very reluctantly by a very sort of childish sounding person. And it's kind of, for that article or for that story, I included that in the body of the text, and I tweeted something out as well, saying we tried this, and then eventually we were tipped off, and that's how we got to ask this question. And I'm sorry to say, but nobody was bothered. Our readers didn't really care. They read the story. It did quite well as a story, based on Trudeau talking about Meta, which is a question that only we would have asked. No chance would anybody else have asked that question, which kind of, I think, vindicates our tenacity. But nobody really cared about the idea that the PMO were trying to withhold information from us and trying to seal off and sequester Trudeau so that he was safer than he otherwise would have been. So I feel like people just maybe aren't bothered.
So do you think, though, that ends up being part of the issue, right? Iain, you perfectly described exactly what happens in the punitive fashion with elected officials when you've pressed them too hard or overstepped or done something that they didn't like. The NDP are typically have been known for their, and let's not even say NDP, let's talk about the health authorities, have been very punitive towards those that speak out, right? But then that prevents those from speaking out, and the problems get worse. If you don't tell the story, if you if you don't say what's happening, how will the general public know? And you're right, it might not be the first story, but it might be the fifth story that actually is like, wait a second, these guys can't just be denied and denied and denied and denied and denied. We need better answers. And they're asking great questions like, hey, why don't we do a poll and you guys tell me what questions to ask, and I'm going to try and get in front of the PMO or the PM, or I'm going to try and get in front of whoever comes to visit, or I'm going to try and ask Brenda Bailey. Like, then people are paying attention, right? They're like, whoa, that was my question.
Yeah, make it more personal, I guess. That could be a more like direct democracy. That could be worth trying, but the power in that situation, they wouldn't see it that way. They wouldn't see it as direct democracy. They would see it as entirely our fault, and we were like stirring something up. And I think ultimately there's a power balance, and there always has been, between government and press. And I think in the old days, in like the good old days, the 60s and 70s and earlier than that, the press was just so powerful that they could make threats and it would really scare people in power. But now I feel like the press has just been weakened so much, and it's just, I don't think they're scared anymore. Like, if you're a cynical press officer and you get a email coming in, you can kind of say, I'm just not scared of that. Like, I'm not bothered. And that's like the power dynamic has shifted so much that, you're left sort of shouting into a void.
And especially in Canada with selectively funded, state-funded media, the ones that are at the crumb bowl definitely want to toe the line, so they get to ignore the other ones because they're like not even supporting each other. But we should move on, though. Let's move on to because we could stay on this all day. Let's move on to the budget. Andrew Scheer, the interim opposition leader, put forward a vote yesterday, and they won that vote for the budget, for a spring budget, by 166 to 164. And Dan Albus had this to say to Mark Carney here. We're going to play this clip. We are going to at some point here.
Questions, the honourable member for Okanagan Lake West, South Kelowna.
Mr. Speaker, Parliament demanded a budget from this Liberal government. Last night, a Conservative motion passed calling on the Prime Minister to table a budget this spring. The Liberals are asking Parliament to approve a $500 billion in Liberal spending with no budget. Despite promising to spend less and cap government spending at 2%, they've increased it by 8%. Single moms, seniors, small business owners must budget before they spend. Parliament wants these Liberals to do the same. Will the minority Liberal government listen to the majority in this House and table a budget immediately?
The Right Honourable Prime Minister.
Mr. Speaker, this week was a great week for the London Knights. It was a greater week for the country of Canada. Every First Minister in Canada, from Quebec, from the provinces, from the territories, Government of Canada agreed on a plan to build Canada strong, one Canadian economy out of 13. That's what the province stood before.
The honourable member for Okanagan Lake West, South Kelowna.
Thanks for the update, but what about a budget? Canadians deserve real fiscal management, not excuses or fact-free talking points. And here's some of the facts. Liberal consultant spending is expected to rise 35% to $26 billion, breaking their promise to cut down on consultants. Fact. Wow. Liberals promised $20 billion in elbows up U.S. tariffs, but later dropped them with no regard to affected Canadian workers or fiscal impacts. Fact. The majority of this chamber voted last night for a spring budget. Fact. On what date would the Liberals face the facts and table a budget for their $500 billion in new spending?
The Right Honourable Prime Minister.
Mr. Speaker, the First Ministers agreed on a plan to build this great country. Stand up to Donald Trump. Fact. That's right. Mr. Speaker, the Government of Canada is imposing tariffs that cause maximum impact on the United States, minimum impact on Canada. Fact. On over $60 billion of U.S. exports to Canada. Fact. Raised over $1.7 billion already. Fact, fact, fact.
I would have said fact. You haven't answered the question. Fact.
No. And I mean, I really hope that the Canadian public, expects better than that performance from the Prime Minister. I'm going to give him a little bit of grace in that he's like fresh in. But Dan's questions are MP Elvis absolutely bang on. When the majority of elected officials demand a spring budget, that means the majority of Canadians would like one. And that's how we're to see our democracy, and none other than that. For then Carney to respond by saying that a select, very small group of first ministers got to meet and determine a trajectory without actual any fiscal responsibility, I think is very dangerous and very damaging to the general public's belief and trust in the political system that exists. So I would hope and wish for much better than that. And then his response back with the fact. I mean, that's just that's just political theatrics in my mind.
So the most Canadians I would imagine that had some common sense would want a budget, because that seems like a plausible thing, other than the audience that Iain and I did the story that the only people watching television these days are 65 and older and watching the same dribble that comes through there through state-funded media. Maybe they don't want a budget because they're scared the Liberals or they know the Liberals don't want to put out a budget. As a finance minister in the past in two countries, wouldn't the budget be the cornerstone of your plan? When he ran on that, I have a plan, Poilievre doesn't have a plan, I have a plan. Why not show Canadians the plan? Like, it just doesn't make any sense to me.
Yeah, the only thing that makes sense is that he doesn't want accountability. That's what a budget does. A budget is something that gets introduced to the House. It's something that the parliamentarians could then really debate, digest, call into account, ask questions, figure out where the money's being spent, how it's being spent, what programs are being issued and offered. Carney's response is a vague, platitude. It's basically like, we're going to go somewhere in this direction. Well, that's a non-answer, and it certainly doesn't exude any level of accountability. So I would say that, it's a really big leap between a budget and what Carney's answer was. And I can't believe that you would have the majority voting in that manner and then not responding in kind.
Again, you don't want to have Parliament. You only want so many days for question period, and you don't want to be held accountable. Do Canadians want a government that works under the cover of darkness? We kind of lived through that with Trudeau's government, right? They didn't want to answer anything. They said everything is in a national interest and security, so we can't disclose this, we can't disclose that. We're never going to see some of this stuff. Like there was a speech from an MP, the Dr. Strauss, I think is his last name, where he came out and said that it was almost full-on communism with COVID, and that there's no accountability, and we likely won't see accountability unless we get a change of government. And so the longer this goes out, will we ever see accountability for some of those things, those actions?
No,
Wouldn't
because
be too confident.
Yeah, because it's really in the change of government that the next government goes in and starts exposing things, exposing where, money is being wasted, where money is being spent, where better can be done. And it's almost like a renewal period. Right now, we're suffering underneath a same old.
Yeah. And the first ministers did have a meeting. We don't want to keep you too long. The first ministers, we got about 9 minutes left. The first ministers did meet, and Danielle Smith, I think she's very clear as to what she wants. She wants a pipeline for bitumen. Iain and I talked about this morning. If you want to go back and watch the Really Big Show, Carney will not give a clear answer on the pipeline. They talk about a pipeline and maybe carbon capture and creating what we call it. You got to build an SMR to create the energy to capture the carbon, suck the air out, and do this, and then just a loop. So we're going to create energy to sell energy. It'll just be like a laundromat. So you'll just have all this energy being created to sell energy, and it'll cost you as much of that as you get. You know what I mean? Like it seemed pointless. And then we also did the story and here it is in the United States. They're talking about all the energy they need. They need basically another grid, like the same amount of power, because all these companies, Meta's restarting one of the nuclear reactors in the United States. I think Trump has a plan for 10 SMRs to get online here right away. I still don't hear any concrete plans from Mark Carney. I hear we're going to sit down and we're going to talk. It sounds like the BC forestry thing where we're going to strike a committee and then we're going to talk about it forever. And we don't even bring the right people to the table. How long can we talk before we have any action, I guess is my question.
Yeah, two things were really remarkable about that first ministers meeting. The first one was that BC is gone. EB is in Asia right now. And so he's not even at the table. He's not even advocating for what BC needs. That's really unfortunate timing, as it were, on a trade mission. The only thing I've seen from the trade mission so far is him holding one of those hard bite chips or whatever it is, and that's not going to change the trajectory of where BC is headed right now. So in terms of changing the trajectory, interprovincial trade barriers and being at the table might definitely help. In terms of Danielle Smith, I got to give her props for actually being a dog on a bone. I mean, she is someone that is basically going to draw attention to what her province needs in order for prosperity to happen. And she's going to be relentless on that. I think, thank goodness that Carney's feet are being held to the fire on that. I think it's a very positive thing. And yeah, signing your name to a bunch of platitudes and a bunch of really high level and vague statements and vague, well, that's great, but that's not going to be boots on the ground anytime soon. So it did not give me any hope, that's for sure.
Yeah, I mean, the only positive that I've seen so far was Ontario, Saskatchewan, Alberta, and I think PEI signed a deal between themselves for interprovincial break down the barriers. I didn't see BC at that table either. So I don't know.
BC's whole contribution was Nikki Sharma on the sidelines said doesn't like the idea of a pipeline through BC. Other than that, I don't think BC contributed a thing.
No.
We're going to finish up with this one thing here, and we're going to kind of come back full circle on the media. A volunteer for the Conservative, the fundraiser, mentioned that maybe the votes weren't being counted right. And CBC went out and did a story on it and then took out the brush and painted Poilievre with the Donald Trump sticker on it because of that. And Iain and I talked about that this morning. That's where irresponsible journalism is. Pierre Poilievre has no control over what a volunteer says when he's trying to fundraise. But the CBC, almost like Buttongate, they went and took it and turned it into a story that Iain said was their #1 story on the site.
Still might be, actually. I haven't checked, but I mean, yeah. So the fundraiser, what they were trying to motivate a potential donor, somebody who'd given money in the past. They were trying to motivate them to give money again, and they were saying, look, we need money because the Liberals, and this was in the context of Newfoundland, where there's a really, really tight, there's a couple of tight ones, but they were actually Conservative victories, but only by a few votes. And this fundraiser was trying to say, look, we need money because the Liberals are going to try and flip that somehow, by a recount or judicially or whatever. And we're on edge here. So give us your money kind of thing. I mean, you could say that that's quite a sort of cheeky way to try and raise money. But the idea that that's the national news story, that's the agenda-setting major national news story, and to bring up Stop the Steal in the US and Donald Trump and all the rest of it, and then interview some clown at UBC who says, like, this is very worrying language. It's kind of, and to make it all seem like it's an attempt to discredit Canada's electoral system. Yeah, I would say that that's quite a stretch. And just to take up something you said earlier, Renee, about faith that people have in institutions, I really don't think that's a way to bolster faith in institutions. Neither the media, the CBC, nor politics, nor academia, if you include that clownish professor's comment, nor Elections Canada. I mean, this doesn't strengthen institutions. This weakens them because it's ridiculous. It's a ridiculous story, and yeah, we had a good rant about that earlier, didn't we, Jim?
We did. It's just Mark Carney has acted more like Donald Trump and the fake signings and all these things. And this is what the CBC does, the state-funded media. That this same state-funded media that they're the only ones when Poilievre's platform was to repeal Bill C-18, fund local journalism, and also start spending federal dollars with local independent journalism. And Carney's platform was to increase funding for CBC. And he did that. They won. He increased the funding for CBC. What's the first thing they did? They went out and gave raises to the executives. That in alone should anger Canadians to know, like, that should be the most explosive thing, I would think, that they took money, and they part of the reason was they said, you know, Canadians don't like budget, so we just added that budget onto their salary so we don't have to worry about budgeting.
Yeah, and I think that it's important for
Canadians.
Canadians.
I should say, bonus, yeah.
It's important for Canadians to recognize that other countries call CBC state-funded media. Like they call it what it is. It's only here in Canada that we actually think that there's some neutrality to, you know, the big media outlets. But, you know, as Iain has talked about already today, it's like, you know, if you're threatening any media that steps outside of the box or steps outside of what you're doing, yeah, that's not free and independent media, that's for sure.
And I think, you know, I think Pierre Poilievre hit on this a little bit, but he didn't phrase it in these terms necessarily. But, you know, when he talked about things like the professional colleges, and I can't remember what term he used, but like pressure groups or something like that, special interest groups, that was part of his shtick, wasn't it, to complain about that? I'd say as somebody who's come to this country from another country and maybe has a different perspective to people who were raised here, Canada can seem like that at times. It can seem like there are these cliques, and the media is possibly the cliquiest of all the cliques. And there's this strange like haughtiness, and you know, it's all the people who work in the media are basically all liberals. They're all sort of college educated liberals. They're all quite sort of there's something a little bit snobby about them, a little bit supercilious about them. And I think they have a thing going on. They have this little group, they have their little power circle, and they're trying to protect it. And I think politics and media, that nexus, you know, that is kind of the ultimate clique partnership. And I think Poilievre in part was trying to attack that. He was trying to break that apart, and he obviously failed, but that was part of his platform, I think.
Yeah, and for them to then, you know, retaliate towards Pierre by creating a narrative that isn't real is pretty shallow and pretty disgusting.
Especially after
also the narrative that he's on the way out, apparently, is like the knives are out for Poilievre. But I think that is such a stretch. I mean, I would be absolutely astonished if they got rid of Poilievre. I don't think there's any chance of it at all. But in CBC land, that's like a real possibility.
Rosemary Barton was saying it that night that she has good sources. And also Buttongate. You think that Buttongate would have like made them think twice about doing this story, this exact same story, which could have been a plant as well, because it really has no depth to it, and it's not somebody from authority, yet they chose to do it and make it their big story. And they should put right next to it Buttongate, and then they should, you know, like, anyway, I don't want to rant too much about it, but it's just, like I said this morning, it's disingenuous at best, and it's deceitful at worst.
Yeah, absolutely. Agreed.
Anyway, anything else? Any final thoughts before we wrap up? I know that G7's come up. We'll have lots to talk about that coming up, though. But, you know, the point that Iain made this morning, the G7, they're going to actually live stream the protesters and, you know, give them voice and everything so everybody can hear them, but not the truckers, because they're really worried about freedom of speech. But unless you're driving a semi, I guess.
Yeah. Yeah, it's going to be really interesting. I mean, especially to watch Trump. I mean, he's already prepping. He's already, you know, sending out his media blast to make sure the attention is on him and instead of the G7. And yeah, it'll be really interesting to see what happens.
Yeah, didn't CTV do the story and say, is Trump allowed in Canada?
Our felons allowed in Canada.
That's
That was it.
Yeah.
And then where's Jagmeet? Didn't Jagmeet want to block Trump from coming to Canada as well?
Yeah, totally.
Where is Jagmeet? We actually played a video the other day of Jagmeet. He was at some kind of dance-off somewhere.
Oh, okay. Oh, that's interesting. Yeah.
Oh, we do. Thank you, Renee, for joining us. And I hope everybody enjoyed that, and you'll be back next week.